Chapter 20 covers our cholinergic drugs. So when you're starting with this, you want to make sure you read through our objectives. The reason I wanted to point this out is because some places, I think mostly older places, will call cholinergic agonists or cholinergic drugs parasympathomimetics. So be aware of that. You don't hear that very often. Usually they're called cholinergic agonists or cholinergic drugs, so be aware of that. And then when you think of these, to me, the whole gist is if you can understand the parasympathetic versus the sympathetic nervous system, you've got this whole chapter in the bag and also the next chapter. So do read through our key terms here, paying attention, making sure you understand it. A lot of it goes back to anatomy and physiology, so making sure you understand that. And we really only have our 4 drugs in this chapter, and we're really looking at just 3 of them. So when we're talking about our cholinergic drugs, think about it innervating or acting like that parasympathetic nervous system. So when we innervate that parasympathetic nervous system, it's that rest and digest. Keep that in your brain. That'll make sense when we get to some of our medications. It does make a point to understand the nicotinic receptors versus the muscarinic receptors. So understanding that we have 2 in this, because sometimes they even say the muscarinic receptors are innervated by a specific medication. So just keep that in mind. I just mentioned the parasympathetic there. I'm not going to ask questions about direct acting or indirect acting, and I haven't seen that on NCLEX. I haven't had anyone tell me that. But do note that your textbook divides them that way to see if it helps make any sense to you. Then I mentioned we will pay attention to 4 of the medications in this one. So when we're specifically looking at the mechanism of action for these, it can get really hairy, but I don't want you to get too crazy with it. I want you to think of it as that parasympathetic rest and digest. So when we do that, we're stimulating the intestine to promote GI secretions and motility. We are impacting the bladder to cause urinary frequency. And we're causing constriction of the pupil, or that meiosis, which decreases that intraocular pressure. I always think about this one in the sympathetic nervous system. That's when I want to run away from a bear. But this is when I've caught the bear and I've killed the bear and I want to eat the bear. This is what's happening in that parasympathetic. So I also have increased salivation and sweating. I can have some decreased heart rate and then some bronchial constriction. Again, I'm not running at this point. I'm sitting down and resting, which is why I'm going to see some of those effects. Table 20.1 on page 317 does a really good job of dividing up those receptors, all of it under the parasympathetic nervous system, but then looking at whether it's the muscarinic or nicotinic receptors. That might help. Again, look at those. Again, think we're resting on this stage, so what are we going to be doing when we're resting with this one? Understand the word meiosis. You'll see that one when we have that constriction of that pupil. So some of my indications for our cholinergic drugs is when I need to reduce that intraocular pressure. So for that, think about if an individual's got glaucoma or they're going to have eye surgery. Think about post-operatively if they have bladder atony. That is when they maybe had a Foley catheter during surgery, but then we've removed the Foley catheter and post-operatively they have trouble voiding. So that's post-op bladder atony, and this will help stimulate that bladder relief. Also xerostomia, which is kind of an interesting one on here. Do we have the thing on that one? Unfortunately, that's not up here in our terms, which is kind of unfortunate. I was talking to the dental hygiene students today, and they use that term a lot. So the xerostomia is that excessively dry mouth. And I don't mean just a little dry mouth that a glass of water takes away, but it's a persistent dry mouth that actually will cause some people to stop this medication because of that extreme dry mouth. We can also see some skeletal muscle contraction, which they use in the diagnosis of myasthenia gravis, and it reverses the neuroblocking drugs that we use in some of our anesthesia. We'll also know that we can use some cholinergic drugs as an antidote when we have anticholinergic poisoning, which we'll talk about in the next chapter. When we keep moving on, our contraindication, same as always, we've got that drug allergy. Anytime I've got a GI or GU tract obstruction, that makes sense because they're increasing that motility. So if I've got an obstruction, we don't want to increase that motility, or that's going to cause like a traffic jam in that GI tract or that GU tract. Bradycardia, and then if I have an cardiac electrical pulse conduction defect, we don't. It would be contraindicated with that individual. A couple more that your textbook mentions are hyperthyroidism, epilepsy, hypotension, and COPD, and then you use very cautiously with our Parkinsonian patients. Some of the adverse effects, going to pull that up here. So some of the adverse effects that we might see is overstimulation of that parasympathetic nervous system, which can result in syncope, can cause some hypotension with reflex tachycardia. Think of it as that body's way of trying to get circulation going. We can also see that hypertension or bradycardia, depending on whether those muscarinic or nicotinic receptors are innervated. Do pay attention to the table 20.2 on page 318 that clearly outlines some of those adverse effects. Again, pick out the big ones that I think along the lines of what's most significant for that individual. So pick out those and be able to recognize those. And then when we look at our interactions, basically it's with that anticholinergic medications, some antihistamines, and then some sympathomimetics can also antagonize those cholinergic drugs, so pay attention to that. Then if we use multiple cholinergic drugs together, we can have additive effects, so it's going to exacerbate any of those previous symptoms we mentioned. So let's look at our 3 drugs. My first one that we're looking at is bethanechol or uracil. On this particular medication, we use it to treat that acute post-op or postpartum non-obstructive urinary retention. Again, after delivery or after surgery where they're not able to void after removal of a Foley catheter, we could use it for that. We are going to avoid this medication in individuals that have that questionable GI tract or bladder wall issues. We don't want them to have any retention with them. And some adverse effects associated with this med is syncope, hypotension, again with that reflexive tachycardia, headache, and seizures. My next med is my donepezil or Aricept. Aricept is used with our mild to moderate Alzheimer's patients. It can also be used with the dementia with our patients with Parkinson's. And if we titrate it very carefully, the adverse effects are minimal with this drug. The last drug in this chapter that we need to look at is a Namenda. And although it is not a cholinergic, it is included in this chapter because of its associated treatment with Alzheimer's dementia. And it does so by decreasing the degradation of cognitive symptoms. So it takes them longer to get worse, if you will. So it'll halt that cognitive decline. However, note that on that Namenda, it is only temporary effects, but it can positively impact their quality of life for a period of time. So when we get to Alzheimer's later, it's similar to that Parkinson's. We're not going to cure the disease, but our goal is to halt the progression of that disease. After you read through the chapter, be sure you pay attention to the nursing process on this. Specifically, we want to look at that assessment. What do I need to know before I give this medication? Nice case study if you like those. And then implementation and evaluation. So when I'm implementing it, when I'm giving it, pay attention to that, as well as what should I be evaluating post giving this medication. Next, we'll move on to chapter 21.